Good afternoon. Welcome to our session, Connecticut One State Survival Guide to COVID. This workshop is going to highlight Connecticut's Welfare to Work program response to COVID by shifting to a virtual service delivery system while building staff capacity to deliver services remotely statewide. So I'm very excited. I'm going to give you just a real brief bio of our speakers. You can check out the rest of their bio online, but I want you to know who you're hearing from today. So first we have Erica Tu. She's an operations coordinator in the Jobs First Employment Services Department at the Connecticut Department of Labor. In her current position, she collaborated with workforce boards, state agencies, and program partners to create their new case management system. CT hires and provides ongoing technical support for system users. Mike Bartley is the Jobs First Program Unit Director at the Connecticut Department of Labor. He's a graduate of Fairfield University and has worked at the U.S. Department of Labor for the past 34 years, so lots of experience there. Kimball Branch is the manager of career development services at Workforce Alliance. She graduated from the University of Hartford and has dedicated over 30 years to workforce system development and proficiencies. She began her career as a case manager pre-welfare reform, supporting parents who sought a better future for themselves and their children. So we welcome you to our presentation today. Questions can be asked by typing them into the Q&A box to your right, and we will open up for questions later. There will be some interactive opportunities throughout the presentation, and don't forget there'll be an evaluation at the end that we want you to be sure to complete so that we know how we can do things better next time. So with that, I'm going to turn it over to Erica.
Great, thank you, Robin. All right, so I'm going to launch our PowerPoint here on the screen. So we are the Jobs First Employment Services, or the JFIS program, and Kimball will give some background to our program.
Thanks, Erica. In Connecticut, our Welfare to Work program, our TANF Welfare to Work program, is called Jobs First Employment Services, which we lovingly refer to as JFIS. So that's what you're going to hear us calling this program throughout. Our program provides employment services to time-limited recipients of TANF. Our goal is to help parents gain skills to obtain employment and become independent of cash assistance. This program is administered by a couple of different partners, starting with the Department of Labor in partnership with Department of Social Services, who is the benefits administrator in our state, and the 5 workforce development boards, of which I am one. What we do as the workforce boards is we subcontract to actual deliverers of the case management services system. Department of Social Services refers the TANF applicants to an in-person group session that's normally held at the American Job Centers across Connecticut. Of course, this was pre-COVID. Those that attend those sessions are approved for benefits. So if the individuals do not attend the session that they've been referred to, their benefits would not go into effect. It is a precondition. You must attend the Jobs First Employment Services orientation in order to be granted cash. And just for reference, in the state of Connecticut, our TANF program is time limited to 21 months for receipt of benefits. So recipients can also receive 2 6-month extensions, and that would give a total of 33 months of assistance. In essence, we're almost say a trinity, a triune body that provides oversight, and it's really done in a partnership. The idea is that we all own this system. So, pandemic shutdown. This is kind of the thing that called a halt to all of our lives, right? So in March 2020, we had an executive order that said from here on out, or at least I shouldn't say from here on out, for the foreseeable future, and I believe they said it for at least a 1-year period, that TFAs benefits would be granted without the standard eligibility requirements, such as that in-person interview with Department of Social Services, as well as the referral to the American Job Centers. So in essence, this executive order suspended the Jobs First program. Participants obviously were not mandated to participate in our program any longer. Many of them have young children. Our schools were shut down for in-person teaching. All of the teaching was occurring, remotely. So kids are home. Parents are now, in essence, teachers' aides. How can they participate in our program? So no new referrals came to our program starting mid-March, and all of the state staff and most contractors were ordered home to telework. So this resulted in the closure of all of our American Job Centers for any in-person services. And you might imagine that we all were like, what is this? What are we going to do? So what now? How do we continue to support the families that we're serving? How do we deliver services? How do we still connect with our customer base? Because even if we can't have them as mandatory participants in the program, we still want that connection. We still want to support them. We still want to avail them to resources. And we also want to, connect with them on that human level that we've already established. This is a crisis. Many people were not equipped for this. They did not know how to handle this. They did not know where there were resources to turn to. So we wanted to find a way to continue that connection with our participants, even if they were not mandatory participants. So during this time frame, we had participants that were volunteering. Even though they weren't mandated, there were many who chose to. And actually a relatively sizable group. It probably was about 30% of the participants chose to still engage in some way. But we also had an opportunity to plan and strategize around a program reset. So one of the things that happened was we created this virtual services work group. That was a collaboration of State Department of Labor, again, workforce boards, and the case management entities, with the goal to make necessary changes in service delivery due to COVID, finalize the new JFIS approach that Mike is going to talk a bit about later, and incorporating flexibility, family-centered coaching, and overall program changes to make what we think is a good program a stronger, more effective, efficient program. So we know that we're not alone in what happened with this whole pandemic. Some states reacted differently. Ours chose to put a pause button for almost 2 months, but we're curious. How would you rate your state or tribe's ability to respond to the need for new technology and solutions in order to work remotely and meet the needs of clients? So we want to ask for your input here. How would you rate your state or tribe's response and ability to the need of new technology? Solutions, how did you work with clients during this time? Was it A, you were well prepared to transition to virtual services in your state or tribe? You were somewhat prepared to transition to virtual services? You were poorly prepared to deal with this new virtual world? We're going to take a few minutes and let you respond to that poll.
I think I launched the poll to complement the question, so hopefully people are able to go in and vote on it. Oh, nope, we can't see the poll. Okay, then you know what? If we can't launch the poll, would you guys mind just popping in your A, Bs, or Cs into the chat? I'll close out what I thought I had launched open.
Okay.
Let's see. So now the question remains on the slide, but we don't have the actual poll running.
Yes, just answer in the chat, A, B, or C, in terms of your response, just to give us a sense.
C, B. For our region, I think most states would be a B, Sharon says. Got one A.
Oh, one. I like that. Okay. B. Got it. What I will say is that for us in our region, we were slightly ahead of the curve since we just decided that we were going to implement a team system where staff would split their time between home and office, slightly ahead of when the governor made the decision to press the pause button. So we were already kind of in the process of outfitting staff so that they could work from home. So it didn't take us much of a pivot in order to ramp up to full-time teleworking. But I think everybody was in different kind of situations with regard to that. Some people could respond easily, even within this state, and others struggled in that process. Okay, thanks for your feedback. Erica, you want to talk a little bit more about what we did during this process?
Yeah, absolutely. Thank you, Kimball. So what else can we do? We were equally concerned about our clients, like Kimball was mentioning, and also our staff, of course. So we wanted to know how we could help our staff make this transition, how we could help ourselves make this transition to the new teleworking world. And one of the primary things that was working against us, like all of us, and still is we don't really know when COVID would hypothetically end, right? We didn't know in March 2020, were we going to be home for 1 month or 3 months or a year? And here we are still dealing with different unknowns. So all that unknown can create a lot of stress for individuals, ourselves, and our staff. So we started right out the gate of just making sure we would at least maintain communication with all of our folks, staff and clients, and try to develop opportunities as much as we could to keep everybody engaged. So one of the primary ways we tried to keep all of our staff engaged is create as many different staff development opportunities as we could. And these covered a wide range of different topics. So I'll just highlight a few of them. The virtual case management with a holistic approach webinar series. This was about a 1-hour webinar series that we had from around May to around November of 2020. So it got up and running pretty quickly. But it was there to support our contractors and their own issues with teleworking and stress, as well as ways to support our clients during this time. So the topics were wide-ranging, managing cases remotely, how to work from home, time management, unemployment and the impact on families, teenagers, and homeschooling, dealing with the new normal. And then the vendor also provided a few different guest speakers, such as Dr. Beverly Ford, who's been on a few different TANF conferences too, along with other life coaches and industry experts as well. Also, we were simultaneously pursuing the Certified Employment Interviewing Credential, otherwise known as the CEIP. That is a nationally recognized credential that gives our case managers the tools to best support clients in their ability to make a really good first impression during that job interview process, as well as giving them education on ways to know how to address different formats or different questions that could be thrown at them. So staff were taking the CEIP credential while they were doing all these other trainings. Another nice one was what we called Motivational Fridays. So early on, we had a speaker do just 5 to 10 minute quick YouTube videos that staff could log on Fridays and watch. And they were just motivational messages to support the staff that are working from home. And I think the series was called We Got This. So it was just a good way to boost everybody's support and confidence level as they were all working through the new procedures. We also did a racial equity training. This was a voluntary 4-day training on racial equity. It covered a whole lot of information in a short period of time. So history of race in the United States, the impact of race on policy, how implicit bias can shape our views and our outlook, but also very importantly gave tools to recognize biases so we can strive to make more equitable environments for all of our program participants. Let's see, intimate partner violence. As we know, unfortunately, COVID with the stay-at-home orders left many people home with their own abusers. So there was a dramatic increase in IPV situations, at least in the state of Connecticut. So we partnered with the Connecticut Coalition Against Domestic Violence just to let the staff know about the resources and available opportunities to help vulnerable participants plan to leave or get to leave dangerous situations. So that was a very important training. Trauma-informed care. The Coalition for Supportive Housing shared different tips on how to create safe and supportive spaces, especially during a time of crisis. So we used this in our case management approach, and it gave the case managers a good understanding on the effects of trauma, including the impacts of the COVID-19 pandemic. And then to bring it back onto just system building skills, we also did a case notes management training with Dynamic Works. So that's just your regular case management data entry skills on how to write effective case notes. So we tried to cover a bunch of different types of training topics to keep the staff involved and supported throughout the pandemic. And then, let's see. So what can we do to increase client participation and reduce stress on families? So during COVID and long term, we want our program, the JFIS program, to be accessible to participants to keep them engaged and reduce the stress or any administrative burdens that may have previously prevented participation as it might have in the past. So we made some changes that were implemented to include virtual service delivery, or where it was physically possible due to constraints on who's able to visit an office, a hybrid approach in some locations. So that's all based on safety measures, which could potentially change day to day. We also have reduced our required hours of participation for each week. So Mike's going to explain a little bit more about that. But we basically just wanted greater flexibility for our families to participate in meaningful ways with less of a threat of cash penalties for non-participation. So to support our kind of changing attitudes about not sanctioning families and placing a greater emphasis on barrier intervention programs, we partnered with some barrier intervention family service agencies to just go out and do early intervention investigation if there's barriers from participating or barriers to employment that our participants might be facing. So Mike will also talk a little bit about that too in a little bit. And then also our last thing is we eliminated a paperwork burden on our clients. So we eliminated the formal job logs as we had in the past. Kimball will speak to this in a bit, but we replaced them with clients kind of more summarizing what they've done within their own words to get a better idea of the progress they've achieved week to week in their job searches. So at this point, I'm going to turn it over to Mike, who's going to cover our family-centered coaching approach.
Great. Thanks a lot, Erica. So historically, I think as Kimball had mentioned earlier, our Jobs First program orientations have traditionally been conducted in group settings and in person at the American Job Centers. But obviously, as of last March of 2020, COVID changed all that. And it also changed our plans for implementing some of our new family-centered coaching strategies into our orientations. And so this all started about 2 years ago when we put all of our Jobs First case managers around the state of Connecticut, and that was about 65 or 70 of them, as well as our Workforce Development Board administrators who work on the JFIS program, and our own team at the Department of Labor through a 4-day family-centered coaching training. And it was a really intensive training that involved a lot of role playing, a lot of case manager client role playing that was really effective. And all of the workforce boards and our case managers were gung-ho and on board with transitioning to a new model. And that model was moving toward from a group orientation session to a one-on-one orientation session. And the plan was that we really wanted these one-on-one orientations to focus on this whole family approach. And we wanted to focus on the hopes and dreams of the clients and talk about, not just the requirements of the program, but the hopes and dreams that they had, not just even for themselves, but for their children and their families. We also wanted to work with them at these orientations to identify who the client considered to be part of their family. And when we talk about their family, we're not even necessarily just talking about their blood relatives, but also talking about friends and neighbors and others that they might consider to be part of their families. and also to talk about their support system and who do they have in their life circle that can help them both in small ways and in large. Who can they count on to watch their kids in a pinch if they need to run an errand, for instance. So who can they count on? And we also wanted to talk with them about the identification of what the challenges or barriers are in their lives to being successful, and looking at those challenges through the eyes of the client and having them tell us where they see their blind spots or their challenges, rather than us making our own judgments about what their challenges and barriers are. So one of the other things that we wanted to talk about within these one-on-one orientations was going to be the fact that the client is in the driver's seat. So really that the client is the person calling the shots about what's going to happen to them. And that includes the development of the employment plan, making sure that it's an employment plan that genuinely represents what the client's hopes and dreams are, and one that they can easily support and buy into. We also wanted to try to take the hassle out of things for the client. And that's also one of the sort of foundational principles of family-centered coaching. So in terms of taking the hassle out of things, we went back and looked at some of the forms that we asked people to complete, and look at all of our various processes in the program, and tried to identify things that maybe we asked people to do that weren't absolutely necessary, that were sort of frivolous, and really tried to focus on the things that we absolutely needed from the client. Again, trying to make the experience as pleasant and stress-free for them as humanly possible. While also recognizing the fact that families need different supports at different times in their lives. And we all know that the one size fits all, or the one approach fits all model is not relevant and does not work, and that everybody's different. So moving ahead, in terms of trying to implement family-centered coaching strategies during COVID, that presented a real challenge for us, because we had expected the in-person visits to be a critical part of this, being able to sit across the table from a client face-to-face and be able to shake their hand and look them in the eye, and all the things that go with in-person appointments were all out the window. So now we really had to kind of reset the bar and try to adjust accordingly. And as Kimball mentioned earlier, the American Job Centers were closed to the public. And we knew that some of our clients might not have the technology necessary in order to participate in virtual services. And we knew that a lot of our parents were home with their children while their children were participating in classes remotely at school, and all of the various challenges that go along with that. And in addition, there were a limited number of childcare slots around the state of Connecticut. And at one point in Connecticut, our childcare system was operating at about 44% capacity. So there was simply a lack of childcare slots for parents to put their children into. So in addition, while the referrals to the program were shut down during COVID, new referrals, parents were still allowed to participate in the program as volunteers, but they were not mandated to do so like they normally are. And so one of the pages out of the family-centered coaching playbook was to ask clients what their preferred method of contact was. So this was something that we could do virtually. So for instance, we would ask clients, when it comes time to reminding you about an appointment, for instance, would you rather get a text message from us, or would you rather we called you on the phone, or would you prefer that we emailed you? Again, trying to accommodate the client and do what's best for them. Again, trying to take the hassle out of things for the parent. Another thing that we did during COVID was to utilize a third-party vendor to assist clients in overcoming significant barriers to employment that might prevent them from participating in employment activities. And so in Connecticut, our State Department of Social Services has a contract with this third-party vendor, and their name is the Connecticut Council of Family Service Agencies. And basically what happens is the employment services case manager can refer a client to this third-party vendor, and the vendor will work with the client directly, trying to either eliminate or at least mitigate whatever that barrier is that gets in the way of the client participating in services. So I am going to hit the pause button just for a second, and I'm going to throw the mic back to my buddy Kimball for our second poll question.
Got it. So, what types of adaptations did your state or tribe employ during COVID in order to increase access to services for clients? How did you handle that pause, or if there were any interruptions, or if you had to minimize the numbers that were coming through your centers? I don't know if everybody experienced a complete closure the way that we did in our state. Our governor was taking no prisoners with regard to their handling. So why don't you put in the chat for us what types of adaptations you used to continue to have access or to increase that access to services for your clients. I'll talk a little bit about, some of the things that we did in this state while you all put your answers in the chat for us. We started providing online workshops. We started with one-on-one meetings via Zoom, WebEx, or other platforms. We had even converted our job readiness training into an online provision. So we were able to actually enroll people into job readiness during our center closures. We also issued laptops and hotspots for those who didn't have access. And of course, we had to start all of this with training our staff on the utilization of some of these platforms. A lot of people were unfamiliar with them, yours truly included. And so it was a gear up, but we didn't have a lot of time. We didn't want to have a big gap of a space going without interacting with our customers. So some of this was just calling people on the phone and saying, hey, we're not in the office, but we're still here for you. And here's how you can reach us. You can use my email. We made sure that people were able to use their cell phones, that they were could give the numbers to the customers to text them or contact them. So we all kind of did our own thing, but I think it was important to, I think it still is important to maintain that contact. So what are we seeing?
Oh, I see. Sharon popped in a note. Says most of our regional states moved to online formats, which was a huge help for parents with young children. Seemed to better enable communication. I think that's probably true for us too. No more transportation barriers, right? So
this is true. This is true. Actually, one of the things that we did also that again let people know that we were kind of pivoting from just talking about employment services to caring about our customers' well-being. So we had a we called it a care package distribution for participants. So we gave away 200 care packages that included things to help them with COVID, the hand sanitizers, the masks, the cleaning, disinfectant wipes, diapers, gift card for groceries and supplies at your local Walmart, just to let people know, we're here for you. We care. We know that this is a struggle time. And that was very, very effective. We actually were able to do that last summer. So we did it outside. We were able to maintain social distancing and all of those things. In Puerto Rico, government TANF local offices are still closed to the public. We developed online services platform. Services are delivered online. Same. We're still largely doing things remotely, even though we are most back in the offices on some basis. Our job centers have reopened. We reopened twice. Had another closure when things spiked, but we're back open, and most of us are back full time. Our customers are not back full time. A lot of them are doing remote and virtual access still. Great.
Great.
Okay.
Thank you, Kimball. So this past spring, we decided to make some wholesale changes to the program. And those changes were done in consultation with and in partnership with our Connecticut Department of Social Services, our TFA agency, as well as our Workforce Development Board partners. So why did we decide to make these changes all of a sudden in 2021? Well, there were really three main reasons. The first reason was that the families that we serve in the Jobs First program have endured a considerable amount of stress and trauma throughout this pandemic. And just like the rest of our society, and we felt like a more flexible approach seemed timely based on what everyone has endured throughout these past 18 months now of COVID. So that was the first reason. The second reason was that there was still that scarcity of childcare slots available around the state of Connecticut. And in cities like New Britain, for instance, there was one infant childcare slot available for every 10 infants who needed childcare. So all of the three partner agencies felt like a more flexible approach would be warranted in light of these circumstances and the fact that almost all of our participants are parents. So that was the second reason. And then the third reason was the fact that we currently do not need to worry about meeting the federal work participation rate. And as a lot of you already know, we historically have had to worry about having 50% or more of our clients participating. In Connecticut, the rule historically has been 35 hours a week of employment activities. However, as a result of our dramatically shrinking caseloads throughout the past few years, our state, along with many others, receives a caseload reduction credit from the federal government. And that credit is now so significant that it has literally reduced our work participation rate goal down to 0, which really has sort of freed us up to be more flexible than we've ever been in the past. And so we wanted to implement these changes now for those three reasons. And we thought that these changes would number one, put us more in line with what a lot of other states are doing. And secondly, would put us in line with the goals that are required by the Federal Department of Health and Human Services. And so for some additional background, we had been operating the Jobs First program throughout the past 20 plus years with many of the same rules that we had in place up until this spring. However, much of the multi-generational poverty research that's been done since the program began back in the 1990s suggested that maybe a more flexible approach to serving families living in poverty and trying to sort of meet families where they're at might be more impactful and frankly less stressful on the families that we serve than our previous approach had been. And so in order to implement all these various changes, we conducted 2 half-day training sessions for all of our case managers around the state of Connecticut. And that included all of our workforce board administrators who work on the program as well, to make sure that everybody had a clear understanding about what these new rules were and what the impact was going to be. And the other thing we did was set up these weekly Wednesday afternoon support calls at 1 o'clock, where every case manager is invited to attend these calls, and all the workforce board administrators are invited as well. And it's just a chance for sort of everyone to air out any concerns or questions they might have, any new developments or feedback they want to share about these new rules, and just give everybody a chance to catch up with each other and make sure that everybody's on the same page. So what are these changes that we're talking about? So the first one is a reduction in the number of hours per week. As I had mentioned earlier, it's been 35 hours in Connecticut for the past 20 plus years, and we wanted to shrink that. The second change was around being more flexible in the combination of activities that a client could participate in when we developed their employment plan. The third change was around being more flexible around sanction referrals, and that really meant holding out sanctions as really the absolute path of last resort after everything else has failed. The fourth change really sort of ties into that whole sanction referral change and emphasized a new sense of importance on what we refer to as these barrier intervention referrals, which I had mentioned earlier are the referrals that our employment service case managers make to that third-party vendor, where they go out and they work with the client on mitigating or eliminating the barriers that are standing in the way of their being successful. And for this third-party vendor, prior to COVID, sometimes the vendor would even go out to the client's house and knock on their door if that was most convenient for the client, or if they had difficulty reaching them. That had to be changed during COVID for safety reasons, and so all of that outreach effort by the third-party vendor has been virtual since COVID started last March. And then, as I think Erica had alluded to earlier, we also eliminated these job logs we had been using for the last 20 plus years in order to track clients' attendance. And Kimball's going to elaborate on that in a little bit more detail in just a moment. So one of the new concepts that arose out of this decision to change our rules and procedures was this new concept of what we call goal hours. And so I would say that for the past 20 plus years, we've operated the Jobs First program based on what I would refer to as required hours, that 35-hour-a-week requirement that every client has to meet that's in the program. But this new concept replaces that. And this concept of goal hours really represents the number of hours of employment activities that we expect the client to participate in each week. And so their individual employment plan should consist of some combination of activities that allow them to reach their goal. And the goal hours are simply that. They're a goal rather than a hard and fast rule where there's no flexibility whatsoever. So there's the goal hours, and then there's even on top of that, an additional layer of flexibility as well. And so in a minute, I'm going to turn it over to Erica to talk about that. But before I do that, I just want to touch on these goal hours of participation in a little bit more detail. So one of the things that we've changed is we have sort of divided our client base into two different categories, parents with children under the age of 6 and parents with children over the age of 6. And so the big change here is that if you're a parent with a child under the age of 6, you're not required to do 35 hours a week anymore. You now have goal hours of 20 hours a week. So that's a significant reduction there. And then for the parents with children over the age of 6, they now have goal hours of 30 hours per week rather than the 35 that they had in the past. So again, a little bit less of a change for the parents with the children over 6. But again, there's a whole additional layer of flexibility on top of the goal hours. And I'm going to turn the mic over to Erica to elaborate a little bit more on what that means.
Thanks, Mike. Yeah, so when we introduced the concept of the goal hours, our case managers had some questions about how to identify like who's a currently engaged participant and who might need support services and who would potentially escalate to the level of a sanction referral. So to try and map out a way to have that kind of decision-making process, holding off the sanctions as a last resort, we created this concept called like an acceptable range of hours. So the acceptable range of hours is kind of like a threshold to think about it that way. Because our new program year, the mindset is less about compliance and more about developing a family-centered approach with our clients, getting them motivated and able to obtain and maintain full-time work. So in the past, if a client did not participate in their full 35 hours in a given week, they could have theoretically been subject to a possible referral for sanction. So now, instead of having that kind of hard line in the sand, we implemented the flexibility where if they are participating for at least half of their goal hours in a given week, then they're not going to be facing the threat of a cash penalty. So our case managers were trained to always work towards making sure the client is doing whatever they can to reach their full goal hours. So that minimum threshold is not the goal. The goal is always to reach the 20 or the 30 based on the family. But the acceptable range will build in that flexibility so you don't have to go to that sanction referral route. At first, if somebody's falling below their goal hours, the first course of action is just for that case manager to have a conversation with the client. And then just investigate, like, did you fall short in your hours because there was a one-time issue, like maybe you lost childcare for one particular day? If so, it's just a short-term issue. You're not going to foresee that happening again next week. But if there is an indication that something could be a longer-term problem, like maybe the client ends up disclosing substance use issue or a mental health concern, then you can bring in a referral to a supportive agency like one of those family service agencies Mike was mentioning. So it's just an indicator to see if a client needs more support to meet their goal. Because we can always refer out to family service agencies to investigate barriers at any given time. But especially when a client is falling short in their goal hours, we want to know how we can best support them so we can get them up to those full-time hours, because maintaining those full-time hours will be the best hopeful track record for them to pursue full-time employment. So we help investigate barriers and to prevent participation, and then we'll do referrals out in case people are falling short. So then for the concept of how we're tracking the job search, I'll switch it over to Kimball so she can explain that piece. I think you're muted, Kimball. Gotcha.
Sorry about that. Doggone it. I thought I was past that kind of a, that's a green move right there. I'm sorry, folks. Anyhow, so the dreaded job search logs, I think none of us are sad to see the end of that era, right? So I think our case managers as well as our job seeker customers are thrilled at this prospect. So we wanted to reduce the burden of the job logs and decided let's figure out another way to find out kind of what happened in the past week with the job search effort. So what we decided to do is implement a new weekly progress summary email process. So this way, the client is still accountable for those hours that they're supposed to be spending in their job search activities, but just without the burden of, clocking every single item on the job search log. So clients enrolled in any number of hours of job search per week will email their case managers every Friday. The emails are to provide a summary of what they did each week, the progress made, struggles, estimated number of hours that they participated out of the goal that they're given. If a client is unable to send the email due to a lack of device or internet, then an alternative method can be made. It could be through a phone call. It could be dropping in and meeting with the case manager. Whatever works, again, for the client is the pursuit here. So we want to reduce pain points for them and make it work for them. And previously, the job logs really became this compliance-driven tool, documenting hours each day. We want more of an interaction. The idea here is to make it more of their voice. What is important to them? How do they rank or rate what they've accomplished in the last week, and let them talk to us about that. So the goal here with the new weekly progress summary emails is to have the client be more forthcoming about how things are going. Again, their voice, an opportunity for the case managers to utilize their family-centered coaching strategies, focus on what is working and offer suggestions to help with what is not, information that you would not normally have seen on a job log. I think all of us were starting to feel like the customer was starting to become invisible because of the emphasis on the form, not necessarily the person, not necessarily how they're feeling, what their motivation levels are looking like, what are their struggles, what are their challenges. We don't want it to be a checkbox. We want this to be interactive, and we want to be able to know how we can support the customers. So we're just getting started with that. This is going to be under close review, but the hope is that this will be a better strategy for the customers and for the case managers to change things from being transactional to more interactive. So with that in mind, we are at poll question number 3. In what ways did COVID strengthen your state or tribe's ability to assist your clients? This is another chat that we're going to need you to fill in the blanks, fill in your answers rather. In what ways did COVID strengthen your state or tribe's ability to assist your clients? And give you a moment to start filling in. I did want to go to Marilyn's answer to the earlier question about what they did to continue services. And it said provided online services and by phone for those who did not have internet. Very good. We had to do similarly. I think one of the things we learned in this process is, you can't make this assumption that everybody has access, right? We really needed to allow for the fact that some of our customers could not access us that way. So we absolutely did as much as we could via phone, and also had a drop box. I like that as well. We had an application pickup and drop box outside for those without internet, and now everyone's back at the office. So in answer to this third question, Tanya is saying that it gave us more flexibility to think outside the box with everyone working remotely. I think we felt similarly. In fact, we were, really kind of pleasantly surprised at how well staff and the customers kind of adjusted and adapted to doing things remotely. People were very effective with their work. We had daily, we call them daily huddles, where teams would get together just for 15 minutes via Zoom to talk about goals for the day. And our agency calls legacy moments, those kind of proud moments, those moments where you feel accomplished in something that really helped your customers. So we had those check-in points happening throughout this period to keep our staff feeling engaged, but also motivated. I see another from Sharon. For our region, we saw a renewed focus on families and increase in flexibilities, and it seems like most of our states are working hard to keep the changes that work moving forward. Absolutely. That's the one thing that we've learned as well, Sharon, that there needs to be a continuation of this hybrid approach. It really has worked for people, particularly parents with children. So no matter what, as we go forward, there are pieces that we expect that we're going to continue to maintain with that virtual access. Thanks.
Great. Thank you, Kimball. And so for the past couple of years, we've tried to focus on implementing different program innovations, both before and after COVID. Some of them that have most of them have a direct impact on our clients. But one of the innovations that we've implemented in the last couple of years is not so much client driven, but has to do with the annual report that we produce for our program. And historically, the annual report had been in the traditional paper format in the form of a booklet that gives you a whole bunch of data about the program, and usually would include some client testimonials as well. But about 3 years ago, we kind of had a hunch that maybe that report was not reaching our intended recipients and may end up on the bottom of the pile on their desks. And so we decided to kind of rethink the way that we issue this annual report. So that was one factor. The other factor was that when I first came to the unit about 5.5 years ago, our funding had been cut by 31% in the very first year. And looking ahead, we saw that a 31% cut in funding was not a good recipe for long-term success or sustainability, and thought that we needed to maybe do something differently in order to try to get the word out about the good work that we're doing, the impact that we're having on families, and also to give clients a chance to express in their own voices what their experience had been with the program. And so what we'd like to do is, if you don't mind, we'd like to spend the next 12 minutes just showing you guys. This was our first annual report that we did in video format. So I'm going to have Erica hit the play button, and then we're going to ask you guys for a reaction in the chat box when we're done.
So we'd love to hear your thoughts on the video. If you'll type that in the chat, we will share those comments as soon as we get through these next couple of slides.
So Kimball, we're going to hand it off to you to cover the refugee.
Got it. Thanks, Mike. So you saw a short clip with Carmela, our case manager here in this region, who's outstationed at our local resettlement agency. It's a partnership with them. We don't do it unless we do it in conjunction with them. And our goal was to meet the refugees where they were comfortable, where they already saw themselves as, this was the place where they got their needs met. This was the place where they got help. So we embedded ourselves there, and we're part of that model, considered part of the help model for participants. And we think the success rate is due mainly to these factors: respect, honor, flexibility, and patience. The staff is part of the team. We're not an outsider. We're not doing our own thing on the side. We join hands. We are part of the IRIS team. We're not just there as an AJC set off to the side. And I think that's what makes it work. Mike, you want to talk a little bit about the financial literacy program?
Sure. Yeah. The financial literacy program is really the last innovation that we were going to talk about today. And right before COVID started, we had come to an agreement with the Connecticut Association for Human Services, and in Connecticut, they're referred to as CAS. And it's a terrific partnership in the sense that they provide financial literacy workshops to all of our Jobs First Employment Service clients, and they were doing it pre-COVID in every single one of our American job centers around the state at no cost to us. And so the workshops were presented by people who were all volunteers, and they were all former employees in the financial services industry. So that included people that were, for instance, former bank managers, bank tellers, accountants, etc. And the clients who attended these workshops were automatically eligible for one-on-one financial coaching that would be specifically tailored toward their individual needs. And so we probably put close to 200 clients through this in-person model of financial literacy workshops. And then COVID hit, and we were, for like a lot of other things, we were forced to abandon this whole model. And the partnership and the workshops were just starting to gain momentum within the American Job Center. So we had to squash that and start to reconsider another way of doing this. And so we're just about to launch, after all these many months have gone by, we're just about to relaunch these workshops in the middle of October statewide, but in a virtual format. So it's really sort of a win-win for everybody, because instead of having volunteers traipsing all over the state of Connecticut and traveling to all these various job centers, in some cases you might have only a couple of people in your class, and other times you might have a little bit more than that. But with this virtual format, it's much easier. It's much less of a burden on the presenters. Number one, it's less travel for them, less of their time. And the other beauty of this is that they can put 100 people in a virtual Zoom workshop on financial literacy, things that they couldn't do pre-COVID. So if there's any good that's come out of COVID in terms of best practices or lessons learned, I think this is one example of that, of how we've evolved on our end and the partners have evolved on their end to be able to offer this virtually. And the client doesn't have to worry about traveling to the American Job Center to attend either. They can stay home with their kids if they want and participate on their phone or their tablet or their computer. So in addition to the new virtual orientation sessions that we're doing, this is sort of another innovation that I would say has come out on the good side as a result of COVID. So I think that's sort of that's it in terms of innovations. I think the next thing we wanted to do is pass the mic off to Erica to give a quick snapshot of some of our program statistics. So Erica?
Yeah, sure. Thanks, Mike. Yeah, so the video was from our program year 19. So just a little bit of an update for 20. We generally had the same population, but we also added a new way to capture food insecurity as a barrier. So we identified that as a huge need last year, and soon we'll be gathering our data for the last program year, even during the shutdown. So we had the same types of barriers with like maybe lower education levels, basic skills deficiencies, and a predominantly female under 30 participant group. So that's what we were looking at last year, and we'll get next year's out soon too. So at this point, I think we would open it up for the comments and Q&A period if anybody has any questions.
Absolutely. If you have any questions and you'd like to type them in the question and answer section over by the room chat, or if you want to type them in the room chat, if that's easier, if you've gotten comfortable in that spot, please feel free to. We've got just a few minutes and would love to hear your thoughts. And we did get a comment from Sharon that the video is so innovative, very proud of the Connecticut team's efforts on this.
Thank you.
Thanks, Sharon. That was one of those things where it's less is more, less of us talking and more of the client telling their own story, right? That's what this is about. So given that opportunity to the clients to talk about how the program helped them, I think was the best strategy and resonates so much more.
And I would also add to that, Kimball, the executive producer of that video was one of our colleagues from our Jobs First unit, Tracy Andruskowitz, and she worked closely with one of our local community colleges, the Middlesex Community College in Middletown, Connecticut, which is in Kimball's region. And they have an absolutely fantastic audio-visual media department that is able to produce a high quality of video. So we've actually partnered with them for, I think, 3 years in a row now. This past year, during COVID, we were forced to do a video that used animated characters because we were not able to get out and interview and videotape clients in person or in workplaces for health and safety reasons. So we probably will not do the video format this year for the same reason for COVID, but hope to get back to doing it in person again in the format that you guys viewed today once COVID is in a little bit better place.
So, Mike, we have a question from Tanya. Tanya would like to know, when looking to update, make changes to your program, did you have any input from your social service office with regard to the TANF rules and regulations?
Great question. Yeah, absolutely. They were involved every single step of the way, and we have had more conversations with them than you can imagine. So we've spent giant chunks of our work week for the last several months talking with them. So the conversations around changing the rules got serious, I'm going to say, probably in the early springtime of this year. And all the changes that we talked about in terms of the goal hours and the relaxed rules about sanctions and the acceptable range of hours that Erica talked about, and heavier reliance on those barrier intervention referrals, all of those changes were implemented effective July 26th. So those have just been in place now for 2 months, but they were absolutely intimately involved in all those decisions. And the workforce boards, all of our workforce boards were as well. So basically what happened was that we would have these back and forth meetings with our colleagues from social services. As we made progress and sort of finalized certain points, we would bring those points back to the workforce boards and say, hey guys, here's what we're thinking so far. Does this make sense to you? And give them the chance to weigh in as well and make sure that that what we were thinking as administrators was sort of jiving with what the folks that were closest to the clients, to make sure that they felt that we were moving in the right direction as well. So that there wasn't any sort of disconnect between what the thought process was on the front line and what the administrators were thinking.
So we also have a note of thanks from Sharon. Thank you so much, Mike, Erica, and Kimball, for putting together such an informative session. It's always a pleasure working with your team, and if you need anything on our end, please don't hesitate to reach out. So nice note of thanks, and I'm sure we all echo that thank you for this very informative presentation. I was wondering, with this fabulous video, do you find that it works as a great marketing tool for your organization as well as serving as a report?
Yeah, it has been because I would say a couple things. I think one of the good things about it is while it was intended as an annual report to meet a statutory requirement, we were able to check that box off. But there have been a number of other types of events where we have been able to like today, for instance, where we're able to share the video. And the other thing I would say is that those client success stories that you saw and heard in the annual report video, we have cherry picked those client success stories and interviews, and we have incorporated them into a different video that we now show at all of our Jobs First orientation sessions. So now that we've moved toward the virtual model, we do go over sort of how the program works in terms of the goal hours and what supports we have available to the client in terms of transportation and childcare and all that. But the client also hears at their very first orientation session from clients that have been through the program and what their experience has been. So what you saw today is what all of our clients are seeing when they go through the orientation for the first time.
Very cool. Very creative use of collateral you've already developed. So we have just a couple minutes left. Just a reminder to all the participants, first of all, thank you very much for joining us today. And please don't forget to complete your surveys. The link is in the chat box. Mike, Erica, Kimball, any final thoughts before we close out?
I guess I would just say thank you to everybody for joining us this afternoon. I know that everybody had a lot of different interesting topics that they could have chosen this afternoon to participate in, and we're honored that you chose our workshop to attend. And it's nice to see and hear feedback from colleagues in other states who are doing similar work from us. That's always interesting and compelling for us. So thank you for all for being here.
Ditto.
Erica?
Oh, just same thank you as well. This was great and great to hear from everybody, and appreciated being able to join the session. So,
well, thank you all very much. It looks like you're doing some fabulous work, and we appreciate you joining us here to share it with everyone. And folks, remember, you can connect in the community. You can do brain dates. You can reach out. Their contact information is here as well as online in the event portal. So with that, we will bid you all adieu. Thank you so much again. Take care and have a wonderful day.
Bye, everybody. Thank
Great.
you.
Thank you, everybody. Take care.
Bye-bye.